MCure AICUG TV. I'm pleased to have with me today Dr. Nimish Shelat. Thank you, sir, for joining us on MCure AICUG TV. He is a pioneer in infertility treatment and he has first test tube baby to be delivered in Gujarat to his credit. He is also a senior consultant at New Birth IVF Gujarat Institute of Reproductive Medicine. We are going to have a conversation with Dr. Nimish Shelat on the topic of oocyte donation. I think that's a very important topic when it comes to a IVF protocol. If there is a woman who is not able to conceive because of the poor ovarian reserve, because of the elderly age, in that context, or somebody who is suffering from the malignancy, or somebody who is a celebrity, Bollywood celebrities and all, who don't want to have a pregnancy at an earlier age. So oocyte donation does becomes a very important and a critical aspect of their life. So sir, what would you like to say about oocyte donation? Who is the ideal donor?
Right. This is a very important topic and most ideal because in the upcoming age and with the advances in technology and science, we have more and more younger women who come forward and would like to donate, and it's in a way also it has got an altruistic value because somebody else is helped. A person who cannot get a child, a woman who cannot bear a child because she cannot produce enough eggs, or if she has got a poor ovarian reserve. These are the kind of patients who will benefit with these egg donation programs, and these programs have to be tailored nicely and they have to be with a proper protocol.
So how do we screen an ideal donor, and what would be those criteria to become an ideal donor?
Ideal donors are those which are almost 21 years of age, considering the age of maturity. They are the ones who should not have any kind of disease, particularly genetic disorder, because genetic disorder then can be carried forward to the woman who produces the child. So the recipient can get a genetic disorder if this woman has genetic disease. So she should be free from genetic disorder. She should be free from any kind of infections which involve the pelvic area, because pelvic infections and viral infections can be carried into the embryo, and that can lead to either miscarriage or congenital abnormality also when the baby is born. So no disease, no genetic disorders, the ones who are, and the one who is mentally very agile, and the one who knows what she is doing, because it's very important to do psychiatric evaluation of these young donors, because they might be very impulsive. Sometimes college girls who want to make money, they just step in, and we see them coming to our clinics, but we don't accept them because they are under a lot of stress of studies. At the same time, we don't want that they do something later they will regret.
Absolutely, sir. I think that's a very important clinical and a societal point, that the person has to be psychologically sound and able to take a proper decision on this important aspect of the oocyte donation. Sir, would you like to address to our fellow gynecologists on the do's and don'ts while performing a oocyte donation?
It is very important to keep all the details of the donor, because this is a very important record. You may be able to trace other issues later on if they crop up while the patient is pregnant, she delivers a baby. So have all the details of the donor. Just because somebody has come to the hospital to donate, and just by professionally reimbursing them, that's not the end of the story. So that person who comes for actual donation, you should have complete profile, including height, weight, health, respiratory and cardiovascular system assessment, and in fact all the systems, neurological system, alimentary system, reproductive system, everything has to be assessed, and that should be a perfectly healthy individual. A donor should not be a diseased. She is not a patient, she is a volunteer actually, and in that case she is to be treated like a volunteer of a perfectly healthy, sound mind and body. So the donor should be screened, or not only that, but she should her blood group has to be assessed, because blood groups are important. The parents who will later on, the recipient parents who will be having the baby, may have a baby which carries the blood group of the donor also.
Right, yeah.
So they have to be counseled. Both have to be counseled, but now since we are focusing on the donor, it's important that her blood group is known. She should not carry HIV infection. She should not be having Australia antigen positive virus or hepatitis C virus, and of course venereal diseases should be totally absent in these kind of donors. So it's very important that these diseases are also screened in these particular donors.
Absolutely. So you being the expert and a senior most in the domain of infertility practice, uh, how do you express your journey of IVF management in your patients? See, if I have to put it just a few years back, say 6-7 years back, and now we are 6-7 years down the line, how the technology has advanced, how the acceptance of the IVF protocols has been
Well,
from the
it
patient's
has
point of view.
advanced at, I would say, mind-boggling speed, because this is one technology which is believed to carry the destiny and dynasty both forward.
Right.
So none of the couples who generally get married, particularly in Indian scenario, would like to remain childless. The ultimate aim of any man and woman getting married is to have a further life with the family, and to have a family one has to reproduce, and reproduction is one issue which is a very sensitive issue, and if it cannot happen normally, and when it is found that the woman here in question is unable to produce her eggs, or if she is producing eggs which are genetically abnormal, if she is getting recurrent miscarriages, she is not able to produce a healthy child because her own eggs are so abnormal that whenever she conceives there is a miscarriage. So recurrent miscarriages and genetic disorders related to the genetics of the mother is also a very good option for egg donation from a healthy donor.
Oh, nice. So, where do you see IVF? Where do you foresee the IVF management in the coming days?
IVF is one thing which I say is a very useful tool, and it is a boon, I would say, but it is sad that it is being misused. I think as it is my duty as an expert, as a pioneer in Gujarat and one of the top centers that we run in the country, it's my duty to be a torchbearer also, because we have gone through more than 25 years of experience in IVF. We have seen the ups and downs and highs and lows, and the thing is, this technology is gradually quite misused by in certain areas, and younger couples who do not achieve a pregnancy, they are sometimes told into going into IVF straight away, and that is not on, because that should not be done unless and until it is established that this couple cannot produce otherwise a normal child, not in a normal way. And this misuse of technology can only be prevented by public awareness.
Yes.
A young couple, just because probably they are earning well and within 2 years they cannot get a child, they cannot jump into IVF.
Right.
IVF is a very advanced technology,
Right.
and it is not mastered by everybody.
Right.
You can see that, like big shops, the centers are opening, and they become small shops which that they are trying to sell IVF rather than actually treat. Selling is different from treating.
Right.
So that's more important. Yeah.
So, what would be that one-liner message that you would like to give to the doctors who have assembled here in Bhubaneswar for such a fantastic conference, and they would carry one message home from your lecture?
Well, I would say that this conference is a conglomerate of a lot of seniors and also juniors, and of course the middle grade consultant gynecologist. So it includes everybody. It also includes the postgraduate students. So I'm sure the message to give, it would be divided into various parts. The postgraduates who are into doing either MD or MS with gynecology, or say DNB or MNMS or whatever, or they are maybe doing MRCOG. These are the youngsters who should realize that you are a doctor first. Your ethics are most important, because you are not going to do business. If you want to do business, just do not join medicine. One thing is that IVF is a very sensitive technology and it can be used for business purpose. So that should not happen. And it is important that do it only if it is indicated. You should assess the patients properly. They should really need it, then you do it. My message to middle grade consultants is, of course, that they are into IVF establishing and they are doing good work, and it's a great boon to the society where they practice. But I'm sure that they should follow ethical standards. Another very important thing I would like to address right now is that don't do anything without consent. Sometimes just because a couple doesn't conceive, without any consent of that couple, eggs are taken from some another fertile woman and used without the knowledge of the parents to produce a baby, just to get a result for the center. It should never happen that way. It should always be done with consent, and it should always be done with full awareness, knowledge, and proper understanding of the parents, the recipient parents.
Absolutely. So I think the consent the understanding and very thorough screening and evaluation of the patient. Everything is important when it comes to IVF.
Yes.
Thank you so much, sir, for joining us on MQR AIC UG TV. Thanks a lot.